Okay. So we're going to talk about Adler for this lecture. And so on the on D2L, you're going to have I'm going to post this lecture, and you've got theory notes, you've got a PowerPoint, you've got a presentation from previous students. And you've got a discussion board, which is another exercise, and it's all about sibling position in a family, or if you're an only child. So we're going to talk about that, and there are sheets in your notes that outline what Adler has to say about sibling position. Um, you know, some of it's probably accurate, but it's generalized. Not everybody's the same. So it's a little too generalized. You can't really apply it to your clients, but you can talk about the concept with your clients. Tell me about your family of origin. Tell me about siblings if you had any, things like that. Because even if everybody doesn't have the same role or reaction to a sibling position, everybody takes on some role based on the family systems. And the interesting thing about Adler is that the he is known as one of the first family systems theorists. So he didn't call it family systems or anything like that. It wasn't like Murray Bowen, but he was the first one to really consider family dynamics as a therapist. Um, so I just want to begin by telling you how I became interested in Adler because um, as an undergrad, before my master's degree, Adler was just another older theorist, like Freud. They were contemporaries. It was like Freud, Erikson, Adler, Jung. They were the big four, and they were all friends. Um, so I just categorized him as somebody in history. And most of my professors in undergrad really didn't talk about Adler very much. They covered what was in the textbook, but that was about it. It was kind of mandatory. I had to know what was on a test. But then, and this is just coincidence, um, when I was at Shippensburg University getting my master's, like you are, um, one of my professors was Becky LaFountain. And she just happened to be the president of the Adlerian Society for the United States chapter. And she just loved Adler. And it was contagious because she was very positive and she started teaching us things that undergrad professors were not telling us about Adler. So it really created more insight for me. And with that insight, I realized that Adler was a very positive person, unlike Freud. And, I think that there are a lot of really valid uh, points that Adler made. And then years later, like after I got my doctorate and I got my first job as a professor, I used one of Adler's techniques in my own life, and it really helped me a lot. And I'll share that when we talk about the technique. A lot of things in Adler's theories are a little misunderstood because sometimes the translation from German or Austrian isn't exact. So, like, for instance, the word superiority, we think of that as being better than somebody else. But that's not really how he saw the word superiority. He he saw the German as being the best that we can be, being better than we were, like always improving ourselves, like becoming more superior as an individual. It's not becoming better than somebody else. So there's some little misunderstandings in some of the translations that we'll have to consider when we go through his theory. But I want to tell you a little bit about his life. And, he was a contemporary of Freud's. He was also from Vienna. He grew up, family, 6 boys, 2 girls. And remember last week when I said so many theorists who are really famous, who have developed some unique things, have kind of a unique personal experience with mortality, either with losing somebody that they care about or facing their own illnesses and possible death. And so at a very young age, Adler's brother Rudolf died. They were both young, Adler and his brother Rudolf. But they lived in a small house. He was a witness to this, and I think he died of an illness. There was pretty high mortality rate back then. And then Adler was also very ill throughout his youth and constantly aware of his own mortality and possible death. And he almost died at the age of 4 from pneumonia. So this was a constant in his early life. And it could have been because of illnesses or lack of personal application, but he was a very poor student when he began school. He didn't do very well in school, but he ended up studying medicine at the University of Vienna, just like Freud did. And then, after studying general medicine, he studied ophthalmology and then finally neurology and psychiatry. So it was kind of winding road for him to get to psychiatry, but he had a pretty decent medical background. So one of his, of course, as a result of his childhood, one of his interests and focuses as a doctor, a medical doctor, was incurable childhood diseases. And of course, this was probably a response to his own illnesses and the loss of his brother. So he worked with Freud for a long time, for like 10 years. And he had been the president of the Psychoanalytic Society. But, Adler had his own contributions. And like I said, if Freud had worked with his friends and colleagues, Freud's theory would have been so much better and more comprehensive than it is today. And so Adler really wanted to contribute and enhance Freud's theory. But instead, it was Freud's way or the highway. And they would argue because Adler's like, well, what about this? Let's incorporate this. And Freud would always put it down and reject it. And so they eventually parted, and Adler resigned the position 1911. The next year, he formed his own society for individual therapy. And so his theory is called theory of individual psychology. And so he served in World War I as a medical doctor. After the war, he opened 32 child guidance clinics in the public schools. And this is seen as one of the very first times uh, uh, school counseling came to be. It wasn't called school counseling, but he really believed in addressing issues as early as possible, which was a good treatment philosophy, both for physical illnesses, but now we know also for emotional issues. The sooner we can help people identify and deal with their emotional issues, the more successful we're going to be in treating them. And he included teachers and social workers and physicians and anybody in the community who would come into the schools to help. And so let's talk about World War I, because he served as a medical doctor in World War I. So this is not World War II with Hitler and all of that. This is World War I. And World War I was a brutal war. So it was a lot of trench warfare. So, if you ever seen that movie All Quiet on the Western Front, and everybody is living in wet and rainy trenches, and the mortality rate is extremely high, because if you got out of the trench and tried to attack, you had machine guns lined up against you. You had a limited amount of ammunition in your weapons, and once it was gone, you had to use bayonets and other weapons. So it turned into hand-to-hand combat. But if you didn't leave the trench, it was the first time they invented mustard gas. And so they used a lot of chemical warfare. Mustard gas is heavier than air, and so it always settles in the lowest point. And the lowest point is the trenches. So you either stayed in the trench and your gas mask is only good for so long, and or you got out of the trench and had to face, being shot at. And so there's that trauma. And the other trauma that was encountered by so many in the military was brain injury as a result of concussion from a blast. So this is one of the first wars where they would use shells that exploded. So even if you were far enough away that you weren't injured by shrapnel, just the blast of the explosion could cause brain injury. And so what would actually happen is soldiers would get what's called a contre coup, and your brain, when the blast hit you, the brain would hit one side of your skull, depending on where you're facing, and it would bounce off that side of your skull and hit the other side of your skull. And now back then, they didn't have like CAT scans or MRIs or anything like that. So Adler was one of the first people to look at the patients who had experienced this and try to look at this patient as a whole person. And, was this a physical brain injury? Was there injury to the frontal lobe that impacted emotions or the ability to function? Or was it an emotional issue because of PTSD? They didn't have the diagnosis PTSD back then. They would call it like being shell-shocked, which is a result of those concussive impacts from the blast. And but this is really, the first understanding of post-traumatic stress disorder, even though they didn't call it that. And even my own father, who was in World War II, I know he had PTSD, but they didn't even have that diagnosis when he was in World War II. Um, so, the soldiers would self-medicate or not talk about things and try to bury emotionally what happened, or pick any of the criteria or symptomology from PTSD, and that's what was happening. So Adler tried to, figure out, is it a combination of physical and emotional? Is it one or the other? And he would really consider the person as a whole person, both physical and emotional. So I think he learned a lot from being a doctor during World War I. Eventually, he came to the US, lectured in the 20s. His theory grew. He ended up dying of heart failure. There are Alfred Adler schools and institutes all over the world. And I think at the end of each section of your notes for every theorist, there are probably links to those institutes if you want to click on them and go there. So one of the interesting things is that Adler believed in the benefits of education on both an individual and as a society. He believed that re-educating people could reshape society. Um, so, and I guess that could be both positive, which is his view, or negative, depending on what the education really is. So, but he was seeing it in a very positive way. Um, you know, so there's a lot of differences between Freud and Adler. So, whereas Freud was talking about, the stages of sexuality, and psychology, Adler stressed social relationships. And I think that's a much more healthy way to look at things. Freud stressed the unconscious, Adler stressed consciousness, and we can make our own decisions and we make positive choices and change in positive ways in our lives. Freud did a lot of blaming, especially for his own parents. Whereas Adler stressed that, yeah, we're not in control of all of the things that happen in our lives, but we can choose how we're going to respond and grow. And even though Adler was a medical doctor, he doesn't use the medical model in psychiatry or psychology. So I think a lot of these things were really reasonable things that he was coming up with. I think that the other thing that I learned, the more I read Adler, one thing I discovered is that so many other theories took Adler's ideas, renamed them, and turned them into their own theory. So for instance, CBT and REBT, they took directly from one of Adler's techniques and turned it into an entire theory, whereas Adler was just using these concepts as one of his many, many techniques. And they don't really even give Adler credit for it, but it's obvious. It's obvious. So a lot of people did draw from Adler. He didn't get the credit he deserved. One of the problems with Adler's theory is that it wasn't presented in an organized way. So, he didn't have like an organized theory. He would write a book and he would talk about all of these different things, but it wasn't a step-by-step guide to treatment, So I think people found it difficult later on people did take his theory, give him credit for it, and put it in a more organized manner. But I think that was really his big stumbling block. It wasn't easy to use. You really had to understand his theory in order to use it properly. So, I think that Adler had his own feelings of inferiority because he wasn't a good student, because he was sick a lot. And, it was his childhood was a difficult time. And so he wasn't doing well in school, and I think he felt inferior to other students. But this is where he coined the phrase inferiority complex, and we even use that today. And so he begins to explore feelings of inferiority in therapy with not only himself, but his clients. And he thinks that feelings of inferiority can be both positive and negative in the ways they impact our lives. So let me give you some examples. So sometimes in the case of Adler got to a point where, okay, he was healthy again, he was getting older, and so he didn't want these feelings of inferiority anymore. So it resulted in motivating him to work harder. He wanted to overcome these feelings of inferiority. He wanted to become a good student. And not only did he become a good student, but he went on to university and became a doctor and everything else. So in a positive way, these feelings can motivate us. He doesn't talk as much about the negative aspect, but feelings of inferiority, we know, can also result in low self-efficacy and low self-esteem. And according to Bandura, when an individual experiences low self-efficacy, they don't believe that they can succeed, and so they give up too soon. And there's lots of things that go into causing low self-efficacy as well. Societal things. So I don't think he really emphasized the negative parts of feeling inferior, but Bandura looked at it later. And so I think they're both right. I think it depends on resiliency. And, I think one of the interesting things is I was going to say it depends on whether we receive some encouragement and positive help in our lives and maybe have a positive mentor or somebody who supports us in our lives. I know that's what happened to me. I hated high school. I got a job at North American Moving and only went half the time and just wanted out of there. But then when I got to Shippensburg University, I had a number of professors who really took an interest in me and cared about me and mentored me. And it changed my whole outlook towards education. But if that doesn't happen to everybody, I was just lucky that I had those people in my life. Um, so, hopefully as therapists, we can be one of those people. So around the age of 6, he thinks that we begin to plan a life goal. And this is not like Freud. We're not going to figure out what we're going to do the rest of our lives. So this is kind of a misunderstood term. A life goal around the age of 6 is when students begin to pretend play. And in that pretend play, they might pretend, okay, I'm going to be a doctor, you be a patient. I'm going to be a soldier. I'm going to be a veterinarian, bring your stuffed animals, So they begin to play and pretend that they're working in the real world. And what this does is it it creates motivation for the children. It creates an interest. Oh, I want to be a doctor. Well, that's a 6-year-old saying that. The mind might change, in a year. Um, I know. So when my daughter was around 6, she saw that movie Zootopia, and my daughter was extremely small for her age, but she thought, hey, if a rabbit can be a police officer and solve crimes, I can too. And so seeing that small rabbit in Zootopia really gave her the motivation. And for her birthday, she wanted like a fake police badge and a hat and everything else. And so it was right before her birthday party, and we were in Chick-fil-A, and there was a table of police officers. She was very excited, and she wanted to go talk with them. I said, okay. And so they were very nice to her. And she comes back and she says, Dad, I invited them over for my birthday party. And I'm thinking, oh my gosh, I'm really going to have to clean the house. And she says, but they said no, and they gave me a bunch of stickers. I'm like, woof, dodge that bullet. But um, but she was motivated, and it was just pretend. And then after about a year, then she wanted to be a veterinarian, so things change. But it really gave her an interest, and she started looking at all of these different potential opportunities. One of the lessons that I used to give uh, when I was an elementary school counselor was, everybody would say, oh, how are you going to teach career counseling to kindergarten? Well, I had real pictures of real people, and they were all ages, all genders, all races, um, all socioeconomic backgrounds. And I'd put their pictures up on the board, and then I had a list of professions. And I just had the kindergartners try to guess which profession each person was in. One of them was a hairstylist, and they always picked the young woman. And it wasn't. It was an older man who was the hairstylist. Or they picked like, an older man who was a pilot, and it wasn't. It was the younger woman. And, so what they were learning was I was expanding their possibilities. Men and women could do so many jobs. A man can be a nurse, a woman can be a doctor. Doesn't matter what your age is, doesn't matter what your sex is, doesn't matter what your race is, everything. And these were real people. They were friends of mine, but, their professions were not stereotypical. They had broken those stereotypical boundaries. But that just taught the kindergartners that they too could do some things that they had never imagined doing. Like, wow, I could be a pilot, I could be a principal, whatever it is, you know. So, so we expanded their horizons and their concept of opportunities and interests. Um, And so that's what Adler means by life goal. It's creating this motivation and interest so that children begin to explore more and become more motivated to succeed. He believes that humans take an active role in our own development. So things don't just happen to us like Freud believed. He believes that we take an active role as well. And this means that, and I'm going to read this part, this means that our lives are influenced but not determined by heredity and environment. So yeah, you know, things, it's the important thing is not what we have or do not have, but what we're able to do. but he does understand that we have personal limitations. So it's like now, oh, you can be anything you want to be. Well, so I was a long distance runner, uh, and I was pretty good, but I also was based in reality. So, even though I was like one of the youngest people to run a marathon in under 4 hours, I knew that I could never make that my profession because even though I was good, I wasn't good enough. And I had maxed out my physical potential. There were just people who had more natural physical potential. So, what that realization allowed me to do is that I had to shift and I had to think, okay, so this is a healthy thing for me to do, and it's something I enjoy. I just have to place it in the realm of reality. I have to say, this is going to be a great hobby, a great activity to keep me healthy, and it's something I enjoy. But it's not going to be like, I'm never going to the Olympics, I'm not going to be a professional at this. So, we do have to recognize our own limitations and we have to put that in context. What that does, it's not just a negative, it opens the door for other possibilities. So I'm not going to focus on something I'm going to fail at and be disappointed at. I'm going to relegate that to its own domain, and then I'm going to focus on something that has a potential of success. So, I think he's very positive and he really believes in encouraging clients. I just like to have the caveat that it needs to be based in reality as well. So when I did career counseling, I was at a lot of different schools. And some of the schools I was at, uh, you know, they were really successful in sports and, state champs in football and basketball and all of these different sports. And because the school was so successful, uh, everybody's dream was to be an NBA player and to make millions of dollars or to be NFL, and they saw this as a reality because they were so successful. They were state champs. Um, so one of my um, beliefs is that I'm never going to take away somebody's dream because it could be possible. But I also want them to have a backup plan, you know? So I encouraged them. But on the other hand, I said, but let's have a few other plans so that you'll have multiple opportunities. Let's say you get a scholarship to a college and you get to play football there. What's your major going to be? Let's figure out something else you would enjoy doing as well. It's got to be something you like. You still got to go to school if you get a scholarship for football. And so, over the years as a school counselor, hundreds and hundreds of kids, I did have one of them, uh, go to the NFL. He was Bengals. And so he was successful. Um, so I think it's important that people can keep their dreams and yet have other possibilities as well. So he incorporated phenomenology. He wanted to understand other people's subjective reality so that he could understand how they were feeling. Um, he looked at people holistically later. Fritz Perls, not too much later actually, but Fritz Perls also developed Gestalt theory, and Gestalt means whole, looking at the whole person. But I think Adler really caught on to this early. And so, There are some concepts that are a little more difficult to understand with Adler. And one of them is called fictional finalism, um, or could be called the goal of perfection or a guiding self-ideal, depending on what book you read. He refers to this concept by different names. But an individual striving to be perfect in order to be accepted by others. So this is really one of my core things that I look at, a core issue that I look at with every client. Now, Adler, now this is not a good thing, wanting to be perfect in order to be accepted by others. This is really kind of the foundation of what one of the concepts that Carl Rogers eventually expanded upon. So Carl Rogers didn't focus on this negative aspect. He focused on the alternative positive, that everyone deserves to be accepted unconditionally for who they are as a human being. So that's the flip side of what Adler is saying. And so if you put these two theorists together, you've got Adler saying, well, if somebody believes that they have to be perfect in order to be accepted by others, and Rogers says, no, everybody deserves to be loved and accepted for who they are without condition. Adler's really saying that people have been taught, probably by parents, guardians, teachers, that they have to meet conditions in order to be accepted. So some examples of that might be, I've got to get an A in order to get praised. I've got to be good in a sport in order for my parents to be excited about what I do. Got to look a certain way, dress a certain way, act a certain way to meet other people's expectations so that I can be accepted. But that doesn't mean they're being accepted for who they are unconditionally. They're not given the freedom to express their genuine identity. So that's the problem. And then when they get older, when they become adults, they believe that they can only receive love and acceptance in relationships if they meet the other person's expectations. And that's not what love really is. So Adler touched upon this, and this, fictional finalism, or this goal of perfection in order to be accepted. He saw this as kind of a problem, in people's belief systems. People say, oh, I'm not good enough. Good enough for what? Good enough to be loved and accepted for who I am. I'm not good enough to meet other people's expectations. So he talks about some premises regarding personality. So he believes that most behavior is goal-oriented. We get some payoff from our behavior, whether it's positive or negative, or healthy or unhealthy. We can look at that. And it could be based on past experiences, culture, our environment, goals, perception of self. The second one is people strive for success, or what he would call superiority, but it's really like being a successful individual in our own belief system about ourselves, being the best that we could be. In order to overcome feelings of inferiority. So if I become successful in something I enjoy, I'll no longer feel inferior to others. I'll be happy with who I am and what I'm doing. The third one is he wants to consider a person's lifestyle. Adler was one of the first people to create an intake assessment, We do this with every client as therapists. So he was the first one to organize an intake assessment, but he called it a lifestyle assessment. Now, his wasn't, as accurate as ours are today. We look at all the domains, we look at physical, we look at social emotional, we look at 3 domains of relationships, we look at career and academics. Those are the primary domains. There's 3 domains under relationship, family of origin, current significant other, family or none, and peers and friends. So we look at all of these things, psychiatric history, all that kind of stuff. His is not as specific. He looks at all different things within an individual's lifestyle, but it's not quite as accurate as our current ones today. But this is where it all got started. And I think, I think medical doctors did this to some degree, but they really didn't do it as comprehensively as Adler did, because he incorporates the whole person and psychological well-being and history as well as physical. But I know that doctors at that time at least did a physical assessment. So that's probably where he got the idea. He's like, well, I'm going to do this with psychology as well. Okay. This is my favorite concept of Adler's. It's a German word called Gemeinschaftsgefühl, and you can figure out how to spell that. And it means Gemeinschaft, community, Gefühl, feeling. So feeling as though we are part of the community, that we are accepted, and that we contribute to our community. And so this is where my story comes in. So I was in my early 30s. I had just gotten done the doctoral program. And kind of being a perfectionist like Adler was talking about, believing I had to be perfect and succeed in order to be accepted by others. And in fact, I integrated that into my own self-belief, probably based on inferiority complex, that in order for me to accept myself, I had to be successful. So, the first thing I found out was, hey, I got a doctorate and I don't feel any better about myself. The second thing that happened is that my grandmother passed away, and she was one of the caregivers in my life. And I had ended a significant relationship in my life during my last year in the program. I'd gotten a nice job down at the Citadel in Charleston, South Carolina. It was right on the beach in a historic town. But it meant that I had to pack everything and move to another state that was not familiar with. And I had to leave my support group, my friends and family behind. So I felt very isolated and alone. And starting a new job, I had to prepare for all the new classes, and it was a little stressful starting a new job. And I was feeling very isolated, even though it was like a beautiful place to be. And so I started to get depressed. I don't think my depression was deep enough that it could be diagnosed as like major depression or anything, but I wasn't happy. And so being a therapist, I started examining my own feelings. And the more I looked and examined myself, the more unhappy I got. I was just focusing on all these negative things in my life. And it was kind of having the opposite effect on me. So then I was teaching theories class, and I came upon Gemeinschaftsgefühl. And I'm like, wow, if Adler thought that worked, I might as well try it. And so I started to volunteer in the community And I volunteered at a local church and food bank. And so there's a lot of studies that giving creates the same rise in serotonin levels and other brain chemicals as receiving. So, like, receiving a gift, oh, we feel good, but giving a gift, we feel just as good. So, doing for others is physically in our brains creating just as many positive chemicals as receiving good things. The second thing, I wasn't isolated anymore. I was out. I was doing things for others. I was working with people. I was getting to know people. Um, the next thing is that I not only got to know the other volunteers, I got to know the people with whom I was working. And uh, I was no longer focused on my own issues because the people I was helping, they had larger struggles than I was dealing with. They were homeless and hungry, and I was like, wow, these are real big struggles they're dealing with. And, I'll do my best to help them. But I was no longer focused on my own struggles. So it got me out of that self-centered kind of too therapeutic self. And eventually, as time went by, I was no longer depressed and I was feeling part of the community and I had made more friends and it became a very positive experience. So I really believe in this concept of community feeling and participation. And the other thing it taught me, that experience, is that I had never been that depressed before. But the one thing it taught me is that, wow, no matter how hard I try to have empathy for my clients, I'll never really understand the depth of their emotional struggles because I didn't really understand what depression really was until I went through that. And it's probably not as bad as my clients are experiencing. So now, when clients share their feelings with me, I just remind myself I'm going to do the best I can to have empathy for them, to try to understand, but I'll never fully understand the depth of their experience or the way they're feeling. So I'm just going to give them the benefit of the doubt. It's as bad as they say it is. I'm not going to question that. So it gave me that realization. Um, so he did start looking at family structure and birth order. And if somebody has a sibling, like I have a brother who's 2 years younger than me, he would be considered in my family constellation or the birth order structure. However, my sister is like 10 years older than me. It's my choice whether I include or anybody includes somebody that is 7 to 9 years older or younger than them. And the way we make that choice is, were they a big part of our lives or not? Or had they just moved away and they really weren't part of our lives? So my sister was a big part of my life. So I would include her in my family constellation, and I would be a middle child. If she had just moved away and wasn't part of my life, I would be the oldest child. So you see how that works. So birth order structure is included in our family constellation, and later this would become known as our family system. He would include birth order and family structure as part of his lifestyle assessment. He would look at early recollections and birth order, one's earlier lifestyles in relationship to current lifestyles. Have they changed? Have they remained the same? And then I did include handouts in the notes, and at the top of it, it says Adlerian Overview of Birth Order Characteristics. And for that discussion board, you can look through all of the different birth orders and see where you fit and write about whether you think what he's saying is accurate to you or whether you're totally different. He generalizes. So what my experience is that you're going to feel like, yeah, I really fit that positive part, but I don't really fit the negative part. But you know what? When I look at my brother and sister's definition, they fit everything that he says. So see, look at your position, look at your siblings if you have siblings, and see what fits and doesn't fit. Yeah. If somebody what? So you can see which one fits the best. Usually it's the middle child. So the question is, if somebody has 3 kids, are they the second child or the middle child? And I say, look at both categories, see which one fits best, but it's most likely the middle child. Yeah. Okay. So Adler always wondered, well, why don't people just lead healthy lives? And that reminds me of like this Saturday Night Live skit, and they had this guy, and he had played a psychologist on TV, Gary Newman, Bob Newhart show, Bob Newhart, and he'd be sitting at his desk, and people would come in, and they'd tell him an issue, and he'd be like, "Well, just don't do that. Why are you doing that? It seems obvious." But so Adler would say, why don't people lead a healthy lifestyle? And he said that it was due to private logic, concepts about self or others, and life upon which an individual's lifestyle and philosophy is based. Private logic is based on faulty assumptions or conclusions. This reminds me a lot of irrational thoughts or distorted cognitive thoughts. So CBT, REBT. So some examples would be people are convinced nobody cares. People reject others before being rejected. People are too self-critical. People have negative or discouraged outlook. They may struggle with poor self-esteem. All of these things play into CBT and REBT's concepts. So the other thing I included was Stryker's outline. So he took Adler's theory and gave him credit. And he said, I'm going to put this in an organized therapeutic outline, step by step. And so he takes all of the concepts from Adler, puts it in an outline if you want to use Adlerian theory. And he called it ABT, Adlerian Brief Therapy. So if Adler appears on your exam, you could really just apply Stryker's Adlerian therapy. It's an easy thing to do. The other thing I included, and these are photocopies from like the second edition of Corey's book, because he took Adler out of most of his later texts. and or at least he took his techniques out if he included Adler. So I did photocopy these techniques from Adler's book, and I even underlined some of them. So like immediacy, paradoxical intention, um, spitting in the client's soup, acting as if, um, catching oneself. That's how, catching oneself is right out of the CBT handbook. Um, push button technique. Saw this cartoon with two robots, and the robots were covered with buttons and they're pushing each other's buttons. They're like, boy, you really know how to push my buttons. But this technique is the client imagines that they're holding two different buttons, and one is a positive and one is a negative. Could be a positive and negative feeling, could be a positive and negative choice, could be a positive or negative belief, like irrational or rational. And they have the power to choose which button they push. So it kind of gives clients the ability to choose and to control what they need to in their lives. Yeah, so read through the techniques in every question on the exams, no matter what theory, you got to try two techniques. Don't try an easy one like, oh, I'm going to be present for my client. Immediacy. Come on, that's a cop out. Pick a real technique where you have to have a dialogue with the client and you got to have them make some choices and have some interaction. Don't just say you're going to be present for your client. Of course, you're going to be present for your client. Pick a real technique. All right, that's Adler. Questions about Adler or comments?
It's Amanda.
Yeah.
Hi. So I really liked when you talked about the teenagers when you were a school counselor, because I remember before you gave that example, when I was working with adolescents, I worked in an RTF for boys who were drug sellers and users, and some of them were from Philadelphia, and they all thought they were going to be the next Lil Wayne or, an NBA star. And I don't think any of them made it that I knew. But I always wondered, like when we're talking with younger people, like how to go about giving them those realistic options without dashing their dreams. So thanks for those examples.
Yeah, another thing I talk about in career counseling class is that sometimes they have no dream. Sometimes they have no motivation at all. So I want to try to figure out what are some things that they enjoy doing. And it could be graffiti, it could be riding skateboards, it could be uh, hanging out with friends and making up rap songs. So, yeah, they could possibly become a star. But, if it's something like graffiti and skateboarding, sometimes we have to be a little creative. Hey, let's mix those two things together, get a bunch of blank skateboards, and let's see what your graffiti looks like on those boards and see, can you do something with that? Uh, could be a whole career. Um, the uh, the music business, there's a school down in Florida where you learn how to produce music. So they teach you how to use a soundboard and, how to record and how to edit and, all of that kind of stuff. And it's only a 1 year program. But, so if it's something they're interested in, they could probably stick with it for a year, and then they could go get a job in the music industry. So there's a lot of creative alternatives that would provide motivation. And my goal was not only to have them find some type of career, but just get them motivated to graduate high school. Yeah. What else? Yeah.
So I am wondering about how someone using this theory would diagnose a client if you don't believe that they are sick and that they need a cure, but you are funded by insurance or they're seeing you through their, like, yeah, basically.
Okay, so it's not that they don't believe they're sick. It's that they don't believe they're an expert. So the medical model um, is not just about diagnosing, it's about not being equals. So if he doesn't use the medical model, he believes that people are equal, that he just happens to have some form of expertise, um, that he's just not going to go through these steps like he would with a physical ailment. That psychological treatment is much more than just prescribing. That he's going to have to work, he's going to figure out, does this person have an inferiority complex? How are we going to encourage this individual? What psychological techniques are we going to use?
I guess, like, what can you diagnose someone with if you say it's an inferiority complex?
I don't believe they had the DSM then.
Yeah, okay. But if someone was using it today, is
Yeah.
that not how we use it?
Yeah, today, use the DSM.
Yeah. So you figure out what applies most closely to the theories that Adler has about the way.
I think you're being too rigid in your thought process. So, um, you know, 50% of the diagnoses I encounter are incorrect. The so I see diagnoses not as part of my therapeutic treatment. I see it as part of a psychiatric treatment. That's my personal viewpoint.
I agree.
So if I want to prescribe medication, they need a diagnosis. But I would rarely prescribe medication.
Gotcha.
Yeah. And most people saw me in my private practice because they wanted to avoid a diagnosis. Yeah. What else? Yeah, I find people who like control love the DSM.
I don't like the DSM and I don't want.
I'm not referring to you. All right, I think that's a wrap. Have fun with your exercise.